Our next speaker is the grandniece of Eamon Ceannt. Eamon Ceannt was one of the 7 to sign the proclamation of the Irish Republic. During the Rising, Eamon Ceannt had more than 100 volunteers under his command, notably his second in command, Cathal Brugha and W.T. Cosgrave. After the Rising, Eamon Ceannt was held in Kilmainham jail until his execution by firing squad on May 8, 1916, aged only 34. Judy Ceannt is a doctor. She is independently minded with no political affiliation. We thank her for coming here today as a guest speaker. Judy has worked at the coalface of Irish medicine for many years, delivering health care to men, women and children. She has been a tireless advocate for mother and child during that time. Judy?
Good afternoon. My name is Judy Ceannt. I'm a medical doctor and I work as a GP. In 2016, we celebrated the 100th anniversary of the Easter Rising and the men and women who made such sacrifices so that future generations could live freely. The line in the proclamation, to cherish all the children of the nation equally, is more relevant today than ever before. In the forthcoming referendum, we are being asked to remove from the Constitution all the constitutional protection to life of all unborn babies, and to give free rein to the government to bring in whatever abortion laws they want now and in the future. Will we, as a republic, be the first country in the world to vote away the most basic human right in our Constitution, the right to life? Do we want to choose abortion, which is the intentional killing of the unborn child, as England has, where 1 in 5 pregnancies end in abortion? The vast majority is healthy babies of healthy mothers. Once abortion becomes available, it becomes the norm within the society, and pressures will build on mothers due to the existence of this option. Fathers and bosses who don't want to be inconvenienced. Mums and dad who don't want to feel social embarrassment. Schools and colleges can demand that women get with the programme. There can be significant pressure on a woman to choose abortion rather than adoption or parenting. People think if she would only just go and have an abortion, everything would be fine. But that's an illusion. Abortion can't turn back the clock. It can't press the rewind button and make it so that she was never pregnant. It can make it easy for everyone around the woman to forget the pregnancy. But the woman herself, once the initial relief is over, may struggle with grief, regret, guilt, depression for months and years, through long nights, and all her life long she may ponder the irreversible choice that she made. Embedded in my mind is a teenager who came to me when I was a young GP. She had become pregnant as a schoolgirl, had gone with her consent to the UK with her mum to have an abortion because it was in her best interest. She just sat there with tears rolling down her cheeks, saying, "It was my baby. It was my baby." She couldn't express her grief at home, as it would upset her mother, and no one else knew. Abortion is so final, and hidden, silent grief and regret is so damaging to one's mental health and well-being. I have no doubt that for many women there is no regret over having had an abortion, but I do know that for some it's a deeply hidden, silent pain and shame which often expresses itself in depression, alcoholism, suicidal behaviour and just sadness. First, do no harm is the basic law that governs us doctors. And when a pregnant woman comes into me, I have two patients, the woman and her baby. And I am not meant to harm, let alone kill, either of them. And yet the government wants us, the GPs, to become abortionists and expects us to be able to equate that with our conscience. Abortion is not health care. The Taoiseach said on Saturday that it was time to put compassion at the centre of our laws by voting yes in the upcoming referendum. Is it compassionate to kill the youngest, the most helpless members of our society? Late abortions are gruesome and painful for the baby, and even at 12 weeks during a surgical abortion, you can see on ultrasound that the baby is struggling and in distress until it dies. Is it compassionate to women to bring in abortion when you know, and I want to quote what the Taoiseach himself said a few years ago, when you know that abortion puts women's lives at risk because women can die as a result of terminations, can be injured as a result of them, and lose their fertility. And he calls that compassion? True compassion will be to provide professional counselling and perinatal hospice care for mothers whose babies have life-limiting conditions, so that their babies can experience their short lives in an atmosphere where their parents are well supported in every possible way. Obstetricians see the pregnant woman when she is distressed with the diagnosis of her baby's life-limiting condition. As a GP, I care for the woman during her pregnancy and for the months and years afterwards. I see the love and support offered the woman by family and friends during and after her pregnancy. Of course it is heartbreaking, but after the baby dies, the parents and family are left with very precious memories of their baby, of the love that's been shown to them, and they are supported in their grief. Whereas if the baby is aborted, the mother is more isolated in her grief and has an increased risk of depression. I wish the government would tell the truth and clarify confusing misconceptions. 1. Admit that buying abortion pills online is as common in England and in every country where there is already abortion as it is in Ireland. It is not an argument for repealing the 8th. I do agree, however, that buying these pills is very dangerous. Even when used correctly, abortion pills can be associated with severe abdominal pains and torrential bleeding. 2. Admit that the inquest found that Savita Halappanavar's died as a result of medical mismanagement of an aggressive sepsis, which is infection, caused by a multi-drug resistant bacteria. Her obstetrician stated that if she had realised that infection was present, she would have terminated the pregnancy. That would have been good obstetrical practice and allowed for under our present constitution. Ireland is recognised by the World Health Organization as being one of the safest countries in which to be pregnant. We are ranked 6th in the world for our consistently low maternal mortality rate, and that is with our 8th amendment. Obstetrical care in Ireland is excellent. So to conclude, you need to be clear that in this coming referendum, you will only be asked if you want to remove the constitutional protection to life of all unborn babies. You must vote no to stop abortion on demand. Thank you.